Good morning. I'm Dr. Duke Majan. We are broadcasting live laser spine surgery from Duke Spine Institute. Our patient traveled to Florida from Ohio. He's had problems with neck pain going into his left arm for 3.5 years. The MRI demonstrates a herniation at C6-C7 on his left side. That herniation is causing his arm symptoms. He has an annular tear at the back of 6-7 causing neck pain. The neck pain comes from the annular tear. The arm symptoms come from the tear and the herniation affecting the nerve root. He did not want a fusion, so he came here. How are we doing, Dr. Berndes?
I think we're okay.
Yeah, he does have a thicker neck. If you have questions, you feel free to. He's got some twitches, it looks like. Does he have tetany? Shot. 2, 3, 4, 5, 6, 7. All right, so we will need a little bit of a shoulder pull. We're going to get the patient a little more relaxed with some medicine, and then we're going to get started. But he's got this herniation at C6-7. He was recommended by other doctors more invasive treatments, like fusions are more invasive, and artificial discs are far more invasive. And these fusions and artificial discs use metal and plastic, and they tend to fail, where they actually can pull out of the bone or fracture the bones, and the discs can pop out of place, and screws get loose, and people have swallowing problems, trouble with their voice, typically the rest of their life. This patient is having endoscopic surgery. We're not going to put any metal or plastic in his neck. There's no biologics. It's all natural. We're just going to go repair what's been damaged. He's going to help us with that. Can you give me a little extension? So we're going to first place the spinal needle into the disc. I need a little help from my team. Fluoro's all the way down. Okay. Give a little shoulder. Probably want to grab the ball. All right, folks. Let's get started. You think the relaxer's working?
Yes.
All right. Shot. 2, 3, 4, 5, 6, 7. Shot. Don't flex him. Shot. 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 AP. Quickly. Oh, come on, Jordan. Towards you. Looks good. Lateral. Shot. Shot. Good. 2, 3, 4, 5. Everyone agree 6, 7? 2, 3, 4, 5, 6, 7. All right. I think we're in the right disc. Now we just need to get a quick AP view. Make sure that we're in the middle or close to it. Good job, everybody. Very tough one. His neck is short and thick. The kind of neck we don't like, but Jordan, come on. All right. That looks pretty good. Yeah. So we've entered the disc just a little bit to the left of midline, which is fine. That is the side we want to be on, Sean. All right. We are inside the disc. No, you're fine, Jordan. 2, 3, 4, 5, 6, 7. I'm going to do our discogram. One of the nice things about this surgery is shot and shot is the fact, look at the tear in the back of the disc. You guys see that? That's a big tear.
Yes, we do.
And the dye is going out the tear. That should not be there, by the way. The tear should not be in the back of the disc. That's the wall of the disc. Should be holding everything inside. Shot. All right, I'm going to numb up the skin. We're going to go clean up the tear so that it will heal, because it's not able to heal currently. I'm going to do a little numbing medicine. Any questions from our audience?
Yes, we have about 2 questions. First,
before we take them,
yes,
let's get one quick video in.
of course.
Why do people get neck pain? What causes chronic neck pain? There's about 30 things that we know of that are the cause of chronic neck pain, and that accounts for about 99% of chronic neck pain. While I make my incision, it's 4 millimeters. That's it, guys. We're going to do the whole surgery through that tiny little incision. What a difference, huh? Compared to fusion, which is big and invasive. Let's go ahead and show the audience the 30 causes of neck pain. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Which is a few millimeters above the spine. And shot. All right, give me the AP again because it moved. Okay, so we're back already. You can see from the video that we just showed you, there are 30 specific causes of neck pain. And of those 30 causes, the most common cause is going to be a disc herniation. Yeah, it just wants to go back in the same place I put it before. This is just to the right of it. So let's see where this is. Shot. That's good. That's good. Back to a lateral. So we've already placed the needle, done the discogram, made the incision, and we placed the guide wire. We've taken, that's it? Yes, looks good. Shot? Yeah, I'm happy with that. That's nice. Very nice. We're going to head to the back of this disc, and there's a tear back there. We're actually right at the tear now. You can see the tip of the dilator is right at the back of that disc, right where the tear is. Hold on. Just want to get a little further. That's perfect. We're right at the herniation with the tip of the dilator. Now we're going to put this tube over. Did you guys see the tube? I want to show it to you real quick. Right there, 4 millimeters wide. The whole surgery is done through this 4 millimeter wide tube, by the way. So there's no trauma inside to the body. Literally, we cut the skin and that's it. Everything else is spread. We spread fibers apart. When we're done, we're going to take everything out. The fibers come back together. Kind of like putting a pin into your shirt. Once you take the pin out, you don't see a hole. The fibers of the cotton fibers come back. All right, that's what's happening. Except he doesn't have cotton fibers in his neck. He's got muscle fibers and connective tissue fibers. All right. So let's take our questions and then we'll talk about the video.
First question coming from Mike on YouTube,
Hi, Mike.
asking, will you be able to get pressure off the spinal cord?
Yes. Yeah, we're going right to the back where the spinal cord is, and we can get pressure off the spinal cord. Yeah, we're going to be able to see the spinal cord in some cases, probably not in his case because his herniation is not that big. But when we get big herniations on patients that are pushing on the spinal cord, you can actually see the spinal cord. And you can see that we got the pressure off. It's pretty amazing. We can see it better with the, we're done. You can see it better with the endoscope than you can see with anything else. Is Nikki out?
She's being a procedure medical.
Yeah, she asked, but I didn't realize it was like right around the corner. Okay, let's take some more questions then, and then I'll talk about the video.
Next question coming from Catherine on YouTube,
Hi, Catherine. Welcome to our live stream from Duke Spine Institute.
asking, does this work if you have severe arthritis?
Yes, it does. This surgery works. Okay, this surgery is done to treat problems arising from an injury to your disc, whether it's a herniated disc, bulging disc, ruptured disc, protruding disc, extruded disc, slip disc, degenerated disc, arthritic disc, spondylitic disc. All those problems with the disc, and I named every single one. Even an infection of the disc called discitis I can treat with this surgery. It's better treated with this than with open surgery. The advantage for the patient is there's no incision, it's tiny, no big incision, no trouble with swallowing and hoarseness afterwards. There's no bleeding. You see we lost like 3 drops of blood. There's no pain pills after surgery because we're not doing any damage inside, so there's no trauma to your soft tissues, therefore there's no inflammation, there's no pain, so the patients don't take narcotic painkillers. Any other type of surgery which is invasive, you're going to need painkillers, you're going to be laid up for days or weeks recovering. With this surgery, you can go back to work the next day, you can drive a car the next day, you can go shopping, you can go whatever you want to do with some minor restrictions, okay? There's the herniation right there. So yes, even with severe arthritis, we can do this and fix the pain coming from it. This is the best surgery in the world for a disc problem. You need to have the blue towel going right down here, okay? You need 2 blue towels. All right.
No current questions, so we do have a comment coming from Jason on YouTube,
Sure.
saying, hi.
By the way, there's a piece of herniation right there. You guys see it?
Yes, we
In
do.
the tube. I'm going to have to go grab it and pull it out because it's too big. Hi, Jason.
Jason just asked a question on top of this comment saying, hi, you guys have given me hope. I'm from Australia. Mel says I have bulges at T12, L1, L12, and L3-4. Been hospitalized 3 times in 3 years with back spasms. I watch a lot of your content. You're all so caring and also funny and charismatic.
Thank you.
I hope your teachings reach Australia. How can bulging discs and arthritic damage cause severe headaches?
Yeah, great question. So bulging discs in your lower back with arthritis cannot cause headaches. The only way you can get a headache from a bulging disc in your lower back is if your surgeon stuck a needle in your spine and punctured your dura and caused a spinal fluid leak, and now you have a spinal fluid leak. But look at all those herniations that just came out. You guys see that? I'm literally
Yes, we do.
floating them up and out. They're coming out of the tube. So we're releasing the herniations from the back of this disc, right where the herniation is. You guys see the annular tear right there, the white thing? That is the torn annular fiber. And I'm cleaning out the herniations right now. And that annular tear will now heal. It can heal after I remove the herniations. All right, so headaches do not come from lower back disc herniations. Headaches come from, like if you went to see a pain management doctor and they stuck a needle in your back, they hit your dura, which is very common for them to do. They cause spinal fluid leak, and now the spinal fluid is leaking out of your thecal sac where it's supposed to be, and it's leaking into the epidural space. And now you have basically hypotension in your brain, intracerebral hypotension, and you're basically getting headaches from that. That's the only way a herniated disc could indirectly cause a headache. There's no other way in your lower back. In your neck, a herniated disc can cause a headache. We call those cervical. I'm getting water all over my feet. Okay, get the light on, please. What is it? No, I don't want you to get a towel. I want you to figure out why the water is not. It's coming out. It's leaking out. Look at it. It's literally leaking out. I think your problem. Where is your problem? It's not there. Huh? It's literally. Can you figure out where it's coming out of, please?
Maybe there's a hole in the bottom of the bag's leaking. The bag's leaking.
Yeah, the bag is leaking.
The bag is leaking itself.
Why would the bag be leaking? Huh? Who connected this?
I connected.
Yeah. Yeah, it's leaking.
Oh, yeah. Okay, so the
What
little,
is
the
that?
little plastic part came
Uh-huh.
detached
Yeah.
from the bag.
Come detach.
Yeah.
Go ahead and
Is that right here?
reattach it. Reattach it. Oh, the plastic
Yeah,
funnel.
that plastic part that.
Pop out.
All right, so pull it towards you. Maybe it'll.
You pull it down, straight down.
Yeah.
That helps.
Do you get what I'm saying?
Yeah. No, I
That helps?
understand. The disc has lifted off the inside of the plastic bag.
There it goes, right?
Whatever. I guess I'm gonna get soaked. That sucks. That's fine. It's not nothing you guys can do about it. Laser on.
Yes, sir. 2 off, please. Thank you.
All right. So sorry about that. Long story short, headaches don't come from lumbar disc herniations. They can come from cervical disc herniations, but not lumbar. We're just about done. I've got 5 minutes left. 5 minutes left.
Yep.
Okay. Yeah, this is not a big herniation. It's a small one. The hardest part of the surgery was really getting into the herniation. This towel is getting between me and the foot pedal. Look at the herniation right here, guys. Everybody see the blue thing? That is the herniation on
Yes,
the
we
left
do.
side. I'm going to release it, remove it out of the foramen. That is actually in the neural foramen, pressing on the nerve root. You guys are watching the most advanced spine surgery in the world. For treating a herniated disc in the neck, we do this for the back as well. This is far more advanced than microdiscectomy, laminectomy, minimally invasive, artificial disc, fusion. Those surgeries have been around for 30, 40 years, 50 years, and they are highly invasive and they don't work very well. This surgery works every time. We've never had a failure. We had one patient that took a year for their healing to occur, and we had another patient took 6 months. But everybody else, their pain is usually gone within a few days of the surgery. So hopefully this patient will have a great result. Any other questions?
Yes, we do, but before all that, we have a follow-up comment coming from Jason, coming from his question about bulging disc and arthritic damage causing, asking, or saying, sorry, I meant for neck disc issues.
Oh, yeah. Cervical disc herniations definitely cause headaches. See it all the time. The way it does is through what's called inflammation. So you get this tear in the back of the disc right here that you guys are seeing. Then you get that herniation stuck there, like we just were removing it, remember?
Yep.
And the problem is that herniation is your body reacts to that thing. It attacks it. And it sends what's called the inflammatory system, which is your little cells circulating in your bloodstream. So they start attacking that herniation at the back of your disc, and that juice, that inflammatory juice, I mean, that's your body's like chemical defense system. It's very powerful. So it gets onto the covering around your spinal cord and your brain, and it literally, you're right next to the brain, so that covering goes from your spinal cord right up to your brainstem and brain, and it causes a headache. Yeah, we see it all the time. This surgery cures those headaches. We don't cure migraine headaches, but we cure cervicogenic headaches, headaches from a herniated disc in the neck. I've got about 1 minute left. There's a bone spur right there. For those of you who like to see bone spurs removed by the laser, that's it, it's gone. Okay, do I take all 100% of bone spurs out? No. Why? Because most of them don't cause any symptoms. We're not going to take out things that don't cause any symptoms in the patient. That's how you get in trouble. It's called gilding the lily. We don't gild the lily at Duke Spine. We just fix what needs to be fixed, and that's it. I got about 30 seconds left. I don't see any more herniation back here. We've pretty much cleaned it out, so I'm pretty happy with that. There's the foramen once again. Maybe just do a tiny bit there. But by the way, what you're seeing is, remember, the outside of this tube is 4 millimeters. The inside of the tube is 2.8 millimeters. So, my God, that laser fiber is 0.5 millimeter. Look how big it looks with this view. That's why the surgery works so well. It's so precise. There is no other surgery in the world this precise. It's very advanced. Most surgeons don't even know how to do this surgery. Most spine surgeons. They will never know how to do it in their career. All right, we're done.
Sit
Done.
down, please. Thank you.
Good job, everybody. That was not easy. Any other questions from our audience?
Yes, we have about 2 more questions.
Before we take them,
Yes.
let's show them how a herniated disc like this causes neck pain and arm symptoms.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You can see from our video that the way people get neck pain from a herniated disc or degenerated disc is the same. It's inflammation happening in the backside of the disc where what we call the posterior annular tear. That tear is where the herniation escapes from the middle of the disc through the tear into the epidural space around the nerves and spinal cord. By using a laser to clean the tear, remove the herniation stuck in the fibers of the tear, that allows his own body to naturally heal the problem. There's no need for metal, there's no need for fusion, there's no need for artificial disc. This is a natural surgery. We didn't leave any metal in him, no screws, no rods, nothing. He's got a 4 millimeter incision. We lost maybe 5 drops of blood, which is a 1/4 of a milliliter. Wonderful surgery. We're going to show you in just a minute how the surgery is done, but before that, I'll take any questions you might have.
Coming from Lanu on YouTube.
You guys see the incision?
Yes, we do.
Okay, 4 millimeters, not even a 1/4 inch, 4 millimeters. All right, little pressure, and give it another couple of minutes. Yes, Lanu.
Coming from Lanu asking, well, saying, Henry, welcome back to Earth. Thank you. The live stream is broadcast on Facebook and YouTube. Is there any difference between the two? In format-wise, yes, exponentially, but then when it comes to live streaming, I use one website to interconnect all of them. So when it comes to the live streaming, there's not really much of a difference. But given that, next question coming from...
Yeah, there is a difference.
Yeah, of course. But
the YouTube crowd seems to be more sophisticated. I hate to say it. But where there's a Facebook crowd that just loves to bash me for a video that went viral of me basically getting upset with a nurse in the operating room who was trying to hurt our patient intentionally. So I think the YouTube crowd's a little different. I like them both, but I think the YouTube crowd's a little different. They're a little bit more knowledgeable.
Growing up with YouTube, I definitely appreciate YouTube more, that's for sure. Well, with Facebook as well.
Yeah,
But
people on Facebook are very quick to judge.
yeah,
Like they just look at something for 30 seconds, they've already made up their opinion. But people on YouTube take their time, they watch more videos, they learn more, they have like really good questions, they seem to kind of follow more. People on Facebook, I just think it's Facebook format, but on YouTube, like once you start watching one of our surgery videos, then they show you more on the side, and then you can watch more.
yes,
So
exactly.
people on YouTube, like they tend to to dig in deeper. They tend to watch more videos. They tend to educate themselves more about what we're doing, why we're doing it. They're more knowledgeable.
Yeah.
People on Facebook have, I think, they're not presented with the information the same way. So they watch one video and then it's hard to find additional videos. So I like YouTube format better personally.
Yep, I can agree with that as well, most definitely, with all of that. Next question coming from Catherine, once more on YouTube, asking, do you have more than one location?
No, unfortunately we don't. You know, it's so expensive to run a facility like this, like millions and millions of dollars a year, and we can't afford in more than one location. We're a small company. We should have locations all over the world, but the problem is getting the money. And right now with the insurance companies, they don't want to pay for a cure because they know everybody's going to come and get it. Everybody is used to surgery that doesn't really work. And that's what the insurance companies rely on. They rely on people believing that spine surgery doesn't really work, and therefore they avoid it. They don't get it. And they love that. The insurance companies love that fact that people will not do spine surgery because it's so invasive, it's so painful, it's got tons of complications. So they love the fact that they don't have to say no and not pay for surgery. They love that the people just say no themselves and then they don't have to pay for the surgery. They get to keep their money. That's what the insurance companies want to do. They want to keep every dollar you give them so they can be more profitable. But at the same time, they're offering you guys horrible surgeries that are painful and they don't work and they have high complication rates like fusions and artificial discs. The other problem is that the companies that manufacture the screws and rods and cages, these spinal device companies, they don't want people knowing about laser surgery. So all these very powerful hospitals are the same way because we don't do the surgery in the hospital. Hospitals are losing money. Surgeons don't want you to know about it. Pain management doctors don't want you to know about it. Implant companies don't want you to know about it. Insurance companies don't want you to know about it. So it's like we are one tiny little voice in the darkness. And until more people come here and have the surgery done and we get more money coming in, we cannot open more places. We can't afford it.
And then lastly, coming from Jason, once more on YouTube, asking, for those of us that have no chance of getting to see you to fix bulging disc, as I mentioned, what's our best course of action?
Yeah, well, I mean, Jason, it's a really good question. You know, Jason, you know who you're named after? You're named after Jason and the Argonauts. You see, go back and read ancient Greek history. There's a story about Jason and the Golden Fleece. You see, Jason, you're named Jason because your parents knew about Jason and the Argonauts, Jason and the Golden Fleece. And you want to know what Jason did? He didn't give up. He set his mind on a goal and he went and got it. He found the Golden Fleece. He didn't let anything get in his way. He found a way to find the Golden Fleece and capture it. That's the whole story of Jason. Jason never said no. Jason never gave up. Jason didn't compromise. Jason was an uncompromising person. Go read the story. My advice to you is find a way to get here and pay for it. That's my best advice to you. All these other treatments are dangerous and they're going to hurt you and you're going to be in pain the rest of your life from them. This is the only true treatment for a herniated disc. Sorry I don't have a better answer, Jason, but you have a lovely history to your name. Thanks everybody for joining us. Henry, let's leave with our Duke Laser disc repair video.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com.